Hello, I'm Brandon Leonard, Director of Strategic Initiatives with Men's Health Network, and I'm at the Veterans and Sexual Health Dialogue meeting. Today I'm joined by Dr. David Gremillion, who is a member of the Board of Directors for Men's Health Network. David, you served in the Air Force and had a career in the military for over 20 years and also been a physician. Can you tell me a little bit about your experience working with your fellow veterans and how sexual health plays into overall health and wellness?
Brandon, over 20 years, sexual health has changed dramatically during my career. In general, sexual health isn't discussed other than those episodes in which there's a problem with sexual health. And typically we're talking about sexually transmitted diseases. My specialty, infectious disease, found me engrossed in managing sexually transmitted disease, which is at its base a sign of sexual dysfunction. Now I have to say that over 20 years in the military, a lot of sexual dysfunction was submerged, primarily because of the deterrent to sharing that information with a healthcare provider. We find that people who are in the military are very reluctant to do that often for fear that it may somehow impact their career. Now we're hopeful that that has improved, and I see signs now having left the military, certainly in the civilian world, but even among veterans, I see them more willing to come forward and share ideas or concerns about their sexual health.
Today's dialogue discussion brought together a lot of veteran services organizations and organizations working in mental health and other areas of health advocacy to talk about some of the issues that you just discussed. Where do you see, what were your impressions of that conversation, and where do you see that going?
Well, the first impression was a very favorable impression with the level of commitment that veteran services organizations have toward this very narrow issue of sexual dysfunction in veterans returning from deployment or entering the private world after separation. There's a lot of enthusiasm, a lot of very good ideas, and a lot of ways to reach out to that community. The second thing that I noticed was the level of insight. Many individuals have a great awareness of sexual dysfunction and the way that it relates to family members, the way that it relates to spouses, and how it interferes with their quality of life. So I saw two things. I saw, number one, passion for change, and I saw an insight into the issues at hand that was a very interesting experience for me.
And going forward, what do you think is the role of advocacy organizations like the ones who are here today in advancing appropriate supports and services for veterans who are dealing with sexual health issues?
Well, as you know, this whole arena is characterized by difficult communications. It's a private, secretive sort of an issue that you share with a provider. And so it has inherently built into it a very difficult aspect of communication. Many of them came up with some very good ideas through their own service organizations. I found that the potential for using military spouse organizations to reach out to men in their lives who might be having sexual dysfunction, I found that to be a very good idea. I find the newsletters with circulations in the tens of thousands that go out from organizations like the Vietnam Veterans Association. They have a massive constituency, and they have a lot of credibility among that constituency. So what we heard from this group is that not only is it the message that is important to these veterans, it's also the messenger. Because veterans worldwide, and in the U.S. in particular, those who are not expats, those veterans are having difficulty with the credibility of many of the people who are trying to reach out to them. Some are trying to exploit them in certain ways. Some are trying to sell to them in certain ways. But if it is the messenger that has the credibility of these veteran service organizations that we heard from today, those messages are going to get through and have a potential of producing a very good outcome.
One of the other major topics that we talked about today was the impact of a sexual health issue that a veteran may be experiencing on a loved one, on a partner. Can you talk a little bit about what you've seen in working with veterans and their partners and how that can impact a relationship?
Well, we all know that sexual health is a key component of overall health. So that if someone has a dysfunctional sexual health, it's going to find its expression in various other attributes of their mental health, their physical health. It will show itself over time. This, of course, is a huge burden to the spouse who observes this in them. And they may see them at intervals, an interval following a deployment. And then one of the characteristics of today's military is deployment, redeployment, redeployment. One of the spouses here today spoke of her husband being away for 4 deployments, and he was a Coast Guard. And so it is characteristic of today's military that there are large blocks of separation. And although our concern today is with the veteran themselves, there is no doubt that the veteran spouse, the veteran children in that family are affected by these issues just as profoundly and perhaps more so.
Dr. Gremillion, thank you so much for coming to help us moderate today's discussion, and thank you for taking the time to talk with me.
My pleasure. Take care.